So I shared just a minute ago about the governor's intent to end the mask mandate on the 28th, and Ms. Mitchell and myself and the school medical advisor and Mr. Cummings and Ms. Vitale, the chair of the Board of Ed, have had conversations over the past week about that, and I thought I would share just sort of where we are now in the pandemic and how I feel it's different from where we've been. You know, we now have a widely available vaccine that for everyone 5 and older, we expect a vaccine to be available within a few weeks to 6 months to 5. Right now, we have 57% of those. I think, let me make sure I get my numbers right.
Here.
Yeah, 47% are fully vaccinated of the 5 to 11-year-olds. Yeah, I have the whole chart here, but and 57% have initiated vaccination. So I mean, that would be great if that was higher, but that's a pretty good start with that. You know, right now, those who are in the community in general that are at high risk in the community have had an opportunity to be vaccinated. And we are seeing that, you know, right now with like our 65-year-olds, we're at 97% fully vaccinated and 74% boosted. So for the most vulnerable population, we've got a high vaccination rate, good booster rates. And then, and if you look at the whole town, so if you look at how, if somebody was out in public in the whole town, right now we're at 76% of everybody in town fully vaccinated and 43% boosted. So, you know, those types of things are different from where we were a year ago. And in addition, I came across a CDC, page talking about they estimate about 1 out of every 4 cases is actually reported. That was a study that concluded the end of September, but it was kind of the length of the pandemic, and that was their estimate. So right now in Fairfield, we've got 19.3% of our population is vaccinated. So if you do the math, and if that represents 1 out of 4, hi, everybody. We're getting a lot of noise here.
Is there any way to mute from this end?
I can mute, but then we'll have to unmute.
Yeah. So So if you look at that number, that 1 out of every 4 cases, that, you know, and again, it's not an exact number, it's an estimate, but they're saying that, you know, maybe up to 75 to 77% of the community have some natural immunity from having it. And so we've got, you know, vaccine-derived immunity, we've got lots of natural immunity, we've got Omicron being the least severe of the variants that we've had. We've got hospital treatments and outcomes have improved. Therapeutics are becoming available. Our cases and our hospitalization rates are dropping dramatically. Access to testing, both clinical testing and at-home testing, is dramatically improved since the last month. And consistently, COVID has presented less risk to children across several variants now, and so that one thing has been consistent in that it's lower risk to kids, and the same as well. 0 to 19-year-olds have been consistently had the lowest hospitalization rates of any age group throughout the pandemic in Connecticut. And you know, COVID now for the individual is more similar to flu. For society, it has a different impact. I mean, it's when you're taking a whole lot of cases and cramming them into a shorter period. So for society, for schools, for hospitals, it's a different impact. But for the individual, it really is something similar to a flu case right now. And for a lot of the younger individuals, it's a lot of them, it's similar to like a cold. And so, for those reasons, I think, we are at a time when we can revisit this mask mandate locally. And I know there's been not a vote, but an opinion of the Board of Ed that they were interested in moving in that direction, and I fully support that. I've talked to the town medical advisor, school medical advisor about it, Dr. Bruce McDonald. He's in agreement. Just feels like that as long as the rates keep going down and keep trending in the right direction, and Ms. Mitchell and I have talked, and she's supportive of that recommendation as well. So that would be my opinion, is that we consider that. The 28th, I know people would like it earlier, but I think that's a reasonable accommodation. I know some states, New Jersey announced they're going with the 7th of March. If things happen as the governor proposes, that'll essentially be the law. And if it doesn't, then there's a different decision to be made on the 15th. But I would think that while I would say that I think masks offer protection against transmission, and would hope that we would continue to recommend them, but not necessarily require them. And that those who are most burdened and impacted by mask wearing should have the option, or their parents should have the option to make a decision in that regard. So I'll say that up front to my comments. And then I'll go into what's happening locally here. Our test positivity is around 10% today. It's a little higher than the state, but it's down from 23% 3 weeks ago. Our case rate now is and this is one of our concerns about, Dr. McDonald and myself just felt like, maybe we gave a little more time. We're still at 104 cases per 100,000. That's still in the high category. So we are coming down in a significant way, but we're still almost as high as any point we've been in every other wave in the pandemic. But it's going in the right direction, and each week it's taking significant drops. As I said, hospitalizations are coming down. The last 5 weeks in cases, 5 weeks ago we had 1,069 cases in 1 week. This week we're currently at 128. That'll probably go up a few cases over the next couple of days, but it's that's 12% of where we were, and so that's a significant drop. And so those are all good signs. And as I said, we hope to be initiating vaccination of those younger than 5 this month. And that'll be good news, I think. And so I just want to make sure I don't have any other comments. Well, I think that's really what I had today. We're continuing. We've had a couple COVID clinics this past month, and we're continuing to schedule smaller office-based ones for the second doses and boosters. And then we will be planning ordering some of the, they call it younger pediatric vaccine, and hopefully be rolling out those clinics by the end of the month. And then, just the last month, we've just spent a fairly significant amount of time, Andrea and myself, in preparing a lot of the grant progress reports, for the preparedness grant and the ELC grant that we have. And so that's really taken up a lot of our time. And then I think that is all I wanted to add for tonight. Well, I guess we bring these up under communications.
Okay. Thank you very much, Dan.
Sure.
Jill?
Sure. It's Jill Mitchell. I'm the nursing supervisor and assistant director of health. I just want to say, as a follow-up to my report to the board last month, Fairfield Public Schools offered assistance to the school nurses with data entry, which was immediate and very, very helpful. Main office staff from all of the schools at all levels participated in one of 4 training sessions that we offered, and they have continued to work collaboratively with the nursing staff to facilitate data entry for notification to the school community. Thankfully, the case rates have declined in the schools significantly as they have in the community. So the burden on the staff has lessened from beyond capacity highs of January. Contact tracing is no longer done in the school setting, but the nurses continue with surveillance in specific classroom settings. When there has been a significant number of cases in a particular classroom, our protocol is to notify those parents and provide free test kits for the children to bring home. This has occurred actually only once, and there were no other positive cases reported in this instance. Again, it has been challenging for many families to identify source exposure when testing positive, but household exposure continues to be the leading cause of transmission that we can identify. It's either household or unknown. In addition to that, there was a varicella outbreak at Ward High School last week. An outbreak is defined as 3 cases within a 3-week period. The school community at Ward was notified, and a review of class schedules of positive students and unimmunized or immunocompromised students was completed, resulting in no further need for quarantine. The state epidemiology department was also notified and consulted on the matter. In other news, as you may know, Narcan is available at all schools in the town for administration by the school nurses, and given the incident that happened at the beginning of the year, we decided to look a little bit closer to make sure that our one school that doesn't have nursing coverage is the Walter Fitzgerald alternative high school setting. There's no nurse assigned there. They do have Narcan on site, but no one is trained at the school to administer it. So I just reviewed it with the state DPH and spoke to the fire training school people, and they're able to offer some training. We're going to get, it's wonderful, 13 staff members at Walter Fitzgerald have volunteered to be trained just next week on the 22nd of February, so I'm really pleased about that. The nursing department, as I always give you our jobs outlook, currently has 3 vacancies for full, part-time, and sub-school nurses. And we have advertised on the usual job boards as well as social media and through FPS, and the response has been quite good. I interviewed a number of candidates last week, and a half a dozen or so are planned for this week as well. And that is my report.
Thank you, Jill, very much.
Sure.
Now we can move on to communications. Anybody?
So you've received several communications from the through the Board of Health email that you've got, and I'm bringing up a couple of these, and I'm not entirely sure how to handle them, but these were written and specifically stated public comment for the Board of Health meeting. So we have one from Monica Torrance, one from Sarah Nocerino. I printed out the other one, but it's from, oh, I'm sorry. The one from Kat.
Amy,
Ms. Kelly Sadik and Marie Elizabeth Rotondo. And I'm sorry, I printed one out, and it's a resident, lives at 378 Castle Avenue. I don't have the name on the letter. I'm sorry about that. And then LCDK as well submitted public comment for the meeting. And, I'm not sure, Christine said we don't typically read them in full into the minutes or anything like that, but we can note them in the record. And no other official, other than the emails that you've already received to the Board of Health email.
Okay. So that's good. Did anybody have any comments about either Sam's report or Jill's or what? Well, a lot of the information is brand new from today, obviously. So I think that I could say from my standpoint, I guess the first thing is I think to me it's truly remarkable how well things have gone in the schools, and it's a real credit to the staff and to the nurses at the schools that there has been The schools have been able to stay open, and everybody involved, I think, deserves a huge amount of credit because things could have gone very differently. And I think that now, I see it at the hospital, and the statistics definitely are there to show that the number of cases are down, and the positivity rate is coming down. The cases are still there, but from my standpoint, the two main things that I take away from all of this are that not only are the hospital cases down and the positivity rates down, but also that I think that it is time. I think that, and we're seeing it in other states, and we're seeing it, and I'm glad that our governor recognized this as well. That it's at a point now where I think that things are moving definitely in the right direction, and so I totally agree with the decision. Obviously, it's going to be at a local level. Nobody's it's going to be an independent decision in each town, but I would support what they're proposing in terms of having the masking optional. I think we should still encourage it. I think that the different kind of we could talk a lot about the different kind of masks. I mean, for families, for children, or their parents, if they're very concerned, these type of surgical masks that I'm wearing they work, but I think the KN95s and the N95 masks are probably better. That seems to be in terms of personal protection.
Mm-hmm.
So we're sort of switching gears a little bit in terms of moving from sort of protecting other people, which I think in a lot of ways was in a lot of things from a societal standpoint that people were wearing masks to think about other people. I don't think that's so bad for children to have gotten that experience. I mean, it's been very difficult, but there are a few positives I think that come out of this. But I think that by making it optional, I mean, we have to recognize. I read a lot of the emails all of them that came to me the last couple of weeks from individuals who are very concerned about their children who have been affected in a very significant way, and we recognize that, and nobody should think that we don't. And it's greatly affected lots of students' activities, socialization, development, education. And so now the time has come that I think that we can move forward. My feeling is I think the real focus now has to be on getting more and more people vaccinated. I think that, to me, is so crucial because if we follow the path of what happened, from this last summer when we thought things were getting better, so all of a sudden the Delta variant hits and we're back in the thick of it. So I think we really have to do everything we can, and I think trying to do what we can to prevent another variant from coming. I think we're all very lucky. We don't really think about it. We're lucky that the Omicron variant is less severe. It could have easily been. I mean, there are you can talk to infectious disease doctors. There are lots of reasons, but it could have gone the other way, and things would have really been difficult, and the outcome would have been a lot different. So I think the best way to help prevent a new variant from coming and sort of surprising us all is getting people vaccinated, hopefully now that younger children can get vaccinated, and trying to get out to the public as much as we possibly can how safe the vaccine is, what the statistics are, and then move forward. But I think that come the end of the month of February, the students who feel that they no longer, that they would function much better without the mask, take them off, and then they'll be able to continue their educational experience and also the activities that we've talked about that kids have had to postpone for way too long. We can get back to. That's my thoughts.
Some comments, surprisingly. Just kidding. This is Sally Connolly speaking. So thank you, Dr. Hotchkiss, and I do appreciate that. All the letters that came in, I think that was important for everybody to see the perspective of what's been going on in the schools. And, that is something that's come up at every meeting over the last 2 years, but I think has been increasingly important. The mental health piece, speech-language piece, language development, anxiety. and all the other reasons why the kids are either not enjoying school or not thriving in the way that they could be. So I hear what you're saying about like learning to protect other people. I think that has been important, like you said, to a certain extent, but at this point, there is that choice for people to do what's right for them, you know, and what's right for their family. And certainly as we've learned about, you know, cloth masks and about different types of masks that really probably only a very properly fitted KN95 or N95 would truly protect, which is something I'll tell you going in and out of many medical buildings, even most of the medical professionals that I see just on a day-to-day basis, they're wearing a surgical mask, you know, versus an N95, because that would probably be more reserved for the person you know has active COVID symptoms. So I think, you know, going back to that last meeting where we talked about the fact that, okay, let's not send kids in when they're sick and, you know, keep them home, going back to that common sense mentality, especially like you said, Sans, and your discussion that most of the children are presenting with the more flu-like, cold-like symptoms versus other symptoms. So I think those were really, really important. There's a couple thoughts I have. One is, I know the governor brought up that February 28th. I've just heard, I didn't see it set in stone, but I heard Diocese of Bridgeport is already moving to that 2/14, 2/15 date for mass choice. I know there's people who are expecting 2/15 to be that timeline, so just a little, want to kind of bring that into the conversation a bit. I know I have a lot of thoughts. I do want to bring up, I know it wasn't discussed, but I do want to bring up, obviously you saw my emails about the speech language pathology. I'm glad, unfortunately, that, and I want to say I appreciate Sans and Jill. I know that you both had expressed that, you know, mask removal, and Dr. Hotchkiss in the emails was appropriate in the context of speech pathology in the schools. And I am, even though that was a little bit heated, it clearly was not being implemented consistently amongst the schools and amongst the PBTs and all of the students, and they really hadn't proactively explained that to the parents and done what should have been done, in my opinion, based on the addendum that came out in August. So I'm glad that there was an extra push there, because the Director of Special Education then communicated to all of the parents of kids with special education needs and services that they could call a PPT or 504 and discuss it, which I also think is a little bit unnecessary, and other districts have interpreted that differently. But in any case, I'm glad that discussion came up here, because our kids deserve, you know, and actually it was the day after the meeting that we had that the Board of Education had the budget overview, where there was almost $3 million increase in speech language pathology and psych services. So I think that's data that's telling about what's been going on in the schools and like what our kids really need. So those are a few different thoughts. One thing I did notice, Jill, and I know this is more of a Board of Ed thing, but with the job postings, I did see one of the Fairfield Public Schools job posting, and I actually feel that rate per hour for nursing, it seems very low. I mean, is there a way to negotiate? I know you've had a hard time getting in nurses, and it certainly with some emergency funds that came into SPS, it seems like it wouldn't be out of line to see if those could be increased. I mean, especially with nursing being, look at the smile under the mask, I can see that. But it seems like that's something that should maybe be explored, because certainly from the realm that I'm in, those numbers looked a little bit low.
Mm-hmm. You know, the contract is being renegotiated currently.
Mm-hmm.
They did go to mediation on Friday. I don't even know the details of what happened. And we have certainly expressed that to Human Resources with comparisons from other towns. And if you look into it a little bit more deeply, we look at our hourly rate, and there are a lot of variables that go into that, including the school year that Fairfield nurses work, as well as the length of the day that they work. I mean, all of that gets computed into it. And I'm still working with other nursing supervisors to try to find out what actually is the common, consistent rate. I believe that the nurses in their own union have explored that already, but as I said, they were in mediation, and they're moving forward with it.
Bringing up knowing how challenging it is to attract nurses, and obviously that is such
Well, I
an
think that's across the board. That happens not only in the hospital, and
Oh, that's what I mean.
I sometimes laugh when I say, oh, they're leaving hospital nursing to go to school nursing. I mean, I've seen that written many times, and
it's definitely across
on the other
board.
hand, you know, I
That's
have a half a dozen candidates coming in this week to interview. Sometimes money is an issue for them on a personal level, but not across the board, not 100%.
Yeah, I just wanted to ask about it. Thank you.
Christine?
Follow up on that, in terms of human resources, that's town human resources?
Yes,
Just for the record.
For
Just for
clarification, yeah.
clarification that it is town.
the
human
nurses
resources.
are hired by the town of Fairfield,
Right.
Yeah.
that-
under the
that-
health department.
And they're, you know, they're unionized, so their rates are dictated by negotiation in their union contracts.
I just wanted for the record
Yeah.
that it wasn't a board of ed contract that we were, one of our contracts that we were negotiating were Fairfield Public Schools human resources.
And I neglected to say in the communication section that all the emails that mentioned public comment were in favor of mass choice. I should have included that. I kind of said we received them, but didn't say every single one that we got was in favor of mass choice.
Sorry, go ahead.
Okay.
I have a totally different topic of discussion here, or question for your report, Jill. This is Jason Prevelich for the record, for those on the phone. Regarding Narcan, I'm so happy to hear that it's in all the schools, and that the nurses are able to administer it, and that the one school where, you know, there's not a nurse, there's 13 staff members learning how. But is there talk, and, you know, why aren't we making that an effort across the whole school district, have more people with available access to the Narcan? Because we know it works quickly, it saves lives, quicker you can get it to someone, you know, the better off they're going to be. Is there any discussion of that?
Yeah, when we first introduced Narcan at the schools, we were operating under a standing medical order from Dr. McDonald, and that's only for the nurses to administer. We cannot delegate to other individuals any standing orders. We can delegate, you know, a child with an EpiPen order, his order to a teacher, but we can't do it otherwise.
So still a statutory problem then?
No, well, going beyond that, I mean, I feel that our problem now was I really wanted someone in that school to be able to administer it legally. And that was my priority. I have more than enough consideration that I would actually, I'd like to expand it to other staff members in other school settings.
Great.
But I can only do so much.
Oh, of course, yeah, no. Wasn't happening on you, it was just asking. Wonderful, thank you.
Was there any old business that was unfinished, anything that we discussed last time?
Totally on flu, how, are we seeing flu in town?
Very, very little, you know, so it's you know, there is some in the state, but it's very little. You know, the commissioner expressed some concern during the press conference today of you know, somebody had inquired of, a physician had suggested pushing it out a little bit later to push us past the sort of peak of respiratory flu symptoms to mid-March, and they just said, well, you know, we're not really seeing it. We're seeing a little bit of activity, but we just felt like this was a reasonable accommodation of a time period, is kind of how they put it.
I'll say anecdotally, I mean, I just diagnosed my first case of flu in 2 years the other day.
Yeah.
So yeah, we are getting a lot of positives, but at the same time, we're not testing like we normally do during the flu season either.
Yeah.
It's been all about the COVID testing. So I think that definitely skews the number of cases out there, but it's definitely not the same flu season. I mean, our volume in the emergency department is dramatically down from the normal winter season. Honestly, I think in large part because of masks and precautions that are being taken. Not that I'm saying I'm against everything that we've discussed tonight, but I think, you know, our normal cold and flu season is not what it usually is, in large part because of all the precautions that people take now. But flu is absolutely down. But I think we're just not testing at the same time.
Just one more thing. I would still love to see at some point the numbers. I think it would be helpful for people to see it within the school system. You mentioned, each of you have mentioned the natural immunity piece. I do think it would be helpful to see really of the population how many people have had and recovered from COVID within the school.
Within the school population.
Because I just think that would be a really good data point because, like Dr. Hotchkiss said, okay, you know, our you both said the K-5 was 47% having both vaccinations, 57% first vaccination. You know, there are a lot of people who are going to make the choice for themselves and their family that if they already had and recovered from COVID, that they're sticking with the natural immunity piece, you know, and like the CDC said, you know, that did end up being more protective during that Delta wave than many who were vaccinated. So I just think that may actually give some people a bit of a peace of mind to say, okay, this is something that is statistically significant, as far as the likelihood then of getting it again, you know, or being that vector of transmission is less than had there been nothing. Like, you know what I mean?
Sure.
Yeah, I think it's a matter. It's Mark Hotchkiss again. It's a matter of degree. I think that the natural immunity is clearly a factor that some children may have. I'm sure a substantial number of children may have gotten it and were asymptomatic and have developed some immunity. But the immunity that's provided by the vaccine is a little bit different. And so parents and, you know, talk about it with their children. We need to recognize that there is a difference. It's not one. They're not interchangeable. And so for long-term protection from you know the different variants, I think it still makes sense for us, as I said earlier, to really strongly encourage. And I know that the pediatricians and all the healthcare providers involved are continuing to do everything that they can to try to convince people, really try to educate them into the benefits of having the vaccine for not just protecting themselves, but also, you know, that's really the best way to rid ourselves of the possibility of a new variant. And we can't lose sight of that because things happen so quickly. I'm not being alarmist or anything like that. I think that we're in a really good place right now. But I think that the way things have gone now is good. And I also think that, as Sans mentioned, the total number of cases is still pretty high. So I think the target of the end of this month, to me, seems like, you know, the slope is down. We can continue it for another couple of weeks, and I think that will work out very well for everybody in the schools and get things back towards normalcy. I think that will really be very helpful.
Sally, I just have a question. I'm not so sure I knew what you were looking for. You're looking for reinfection?
No, just how many people of the 10,000 students or whatever is just under that in Fairfield Public Schools, how many have had tested positive, basically, of the full.
No.
It's on that side of the desk.
That's on the dashboard.
It's on the
It's just a little, we have to present it a different way probably. You know.
I mean,
Yeah.
Yeah, I mean, I've looked at the dashboard, I didn't think it was, then that would be in Fairfield Public Schools specifically as
That's right.
well. Yeah, you know, just.
I mean, I guess I
Does
have
it
to look and
include any
see.
of
30%.
double
I mean,
infection?
that's what it is.
What's that?
It's about 30%.
30%. Okay.
A little bit over.
But we can look into it and
Yeah, we can certainly be.
have a little
more
discussion offline of what you're looking for.
Yeah, I just wasn't too sure what it
And
was.
then, another thing would be, but maybe that's too complicated, of those people, you know, merging that data with the data of who's been vaccinated. For example, let's say if 47% were vaccinated, but it
That's what I
happened to
thought
be
you
the
were
30%,
asking about.
happened to be the 30% that had, you know what I mean?
Yeah, I mean,
Okay, probably.
we don't necessarily have individual vaccination
Right.
I have to tell you, during the high surge, when we would interview,
Yeah.
patients, that data point was lost often. I mean, it's there, we can certainly find it,
Yeah.
but it was lost.
I don't think it's necessarily worth doing a major wild goose chase either, but,
Okay.
yeah, no, I was just curious.
Oh, but I love looking at the numbers.
Yeah.
So aside from vaccination, in terms of a mitigation factor, I didn't get to hear the press conference. Was there anything else, the superintendent has said if it came down to local choice, that it would be, he would support a mask optional, not looking to put in Fairfield-based mask mandate, especially now where the health data is. Is there any other recommendations that came out of the press conference today, or that you would still recommend, keeping in place as the, masks come off?
Yeah, I think, encouraging vaccination, I mean, that's obviously our number one tool right now is to especially now that this is going to happen, there's probably some individuals that were on the fence, and they might say, okay, maybe now's the time that we're going to take away a potential layer of a mitigation factor. But, again, I think right now we would go with that and continue, as much distance as possible. I wouldn't want to change, in the discussion that I had with Mike, and I think we had, was making sure that, mitigation factors aren't getting in the way of the instruction, because that's the focus right now is making sure that, the children are getting the proper instruction they need, and that the mitigation factors aren't getting in the way of that, and as much as possible. I mean, we're lifting a big mitigation factor here, and so we want to, do that, but not, I don't think we should add additional things to compensate for that. I guess what I'm saying is let's remove this. And then we're going to look at the data. I think everybody was looking at the data to say, all right, how are we doing? Are things still going down the way we want? We've got a lot of momentum going downward right now. We want to keep that going. But we would encourage people to get vaccinated, and the same things that we've been saying all along. We really have to ramp up on our language of, and Ms. Connolly asked, for some additional education material, which we're working on, is, about, really staying home if you're sick. That's really the key thing here. Stay home if you're sick. Get vaccinated if you're willing to get vaccinated, get boosted if you're eligible, and the same types of things that that we've been preaching throughout the pandemic. Good hygiene, hand hygiene, and things like that, to make sure that those measures are being done well.
Right. And I'm sorry.
No, I'm sorry.
That just sort of touched on a question I had for you, actually. Was there any discussion on adjusting the algorithm that we have for when your kid experiences any symptoms that I think most of the parents in town were familiar with now? If you have a symptom, you stay home, the test versus not test, how many days you're out. Any plans to change that at this point?
So right now, that's coming down from the CDC, and the state has adopted that CDC guidance. So, will it never happen? I'm sure it probably will. At some point, we'll get away from and get back to more of a normal, like, if you're sick, stay home till you're not sick, and 24 hours after a fever, and we'll get back to that general standard. But for right now, I think, we've just done two things. In January, we shortened the quarantine and isolation period, and we put kids back into school earlier with a mask on, for the five additional days. And then now we're lifting masks. And so, I don't see that changing right away. But again, I don't think it's off the table that eventually that will change at some point.
And I also think that in terms of adult use of masks, I think, again, I would say common sense. I think that it may be easy for people to say, well, the kids are taking them off in schools, we don't need to wear them when we go to Stop and Shop, or when we're, in a drugstore. But I think that we should still encourage people to do that. I think we also want to encourage people to, if they're going to go and go to restaurants, there's some distance between people, people are going to, those kind of things. I think it all comes down to common sense. But I think that if everybody just keeps in mind that, the schools are sort of separate. I think we should think about that because it's really so important for the kids to like we've talked about. And I think that it totally makes sense. And I think in terms of the rest of us, for adults, we can get through another even couple of months. And if it's not forever. Nobody should think that it's forever, but I think that the longer we can keep that slope on a steady downward course, that's the quickest way we're going to get back to normal life for all of us. Mm-hmm. So hopefully by the summertime, right? So at that point, if we could all think in terms of the long view of all this and not have another upswing with another variant, that's why the vaccinations are so critically important. But I'm very encouraged that that we're moving so far in the right direction, and things are going to be better for everybody, one step at a time.
Jason, I know that the DPH and SDE, State Department of Education, they have promised. They didn't say what it was, but they said that the guidance was ready once the decision, or once the announcement from Governor Lamont happened. So it may be tomorrow. There's always that big Tuesday morning meeting, but we'll see. We'll see.
Great, thank you.
I think there are lots of variables that need to be considered. With positive individuals coming back to the classroom setting, are they going to be wearing a mask? Are they not? I mean, there's a lot to be hashed out there, I think.
Any other comments? If not,
Are we opening up to the people on the phone?
Yeah, no, it's very.
I think Christine has something.
Just want to again thank Jill for all of her work and the nurses. I'm excited about this next step, but also cautiously optimistic that given where we are with the positivity rate, still just as much we can do just to keep our kids healthy and keep our schools open and kind of normal operations. We've been open, but it's still just been a lot of changes for our kids. And the calmer and more stable we can get for everybody in that building, I think the better. And
thanks also to the Board of Ed for supporting us in that, and I am certainly looking forward to it.
Yeah, it'll be better.
Was there any new business? Anything that we didn't discuss? Anything new that anybody wanted to bring up? And if anybody on the phone, if anybody had listening in, if they had any comments, So is there anybody on the phone who wanted to make any comments before we make a motion to adjourn?
No, actually, I'm sorry. I don't know if I unmuted fast enough. This is Mary Francis. I'm just curious to the practitioners out there. Has anybody had patients with long COVID? Symptoms lasting, days, weeks, months?
Yes, I've had a couple of my patients. And my patients are, I'm a nephrologist, so I see patients with hypertension, diabetes, and so there are other comorbidities typically. But I have a couple of younger patients who have had some sort of vague neurologic symptoms, and there are certain centers where they're actually the physicians who are sort of focusing on long COVID. And they're setting up, seeing patients, and so it's not insignificant. Fortunately, it's a small number of patients, but it's not zero for sure. And I've talked to people, and it's a real finding. I mean, as we expect for a novel virus, there are lots of viruses out there where people have extended symptoms for a longer period of time than just the run-of-the-mill influenza and other viruses. So yes, that is something that's out there for sure.
Yeah, I was just curious. It's actually my daughter who's had very bad cardiac symptoms, and she had a very, I have to say, easy COVID run, but has been really suffering since. So I was just curious what everyone else was seeing out there.
Yeah, so sorry.
Yeah.
This is Sally. I definitely, I mean, as far as in the home health, we haven't had a lot of, I mean, we've treated some COVID patients right when they came out, but I didn't see that as a major diagnosis for our patients. I do know in the last meeting that they had, we went over the 2021 Medicaid diagnostic treatment codes, and those were all, I mean, they were all, you know, the comorbidities, I guess, of COVID, nothing that was COVID specific. It was mental health were the top, mental health and psych were actually in the top 2 spots for treatment for Medicaid patients, and then it went to COPD, CHF, complications from pregnancy, substance abuse, alcoholism, so heart disease, so
Excuse me.
yeah, everything under the Medicaid from 2021 in that top 10 were certainly all of the, I hate to say usual suspects, but really of, you know, that we see in healthcare. And like I said, at a lot of other meetings are things that sometimes do come down to personal health decisions that people make for themselves. And I know, I mean, just to touch upon what you said, Dr. Hutchis, I know, I mean, not to devalue that, but certainly people who are going in the nephrology realm are very sick.
So, yeah, we see a whole range. But I think it's been 2 years, so I think we'll 2 years from now, 3 years from now, we'll probably have a better sense about what's really happening and what has happened.
Sure. Yeah.
But I think that it's important for, you know, primary care doctors and everybody who's taking care of patients to just sort of, you know, have that in their in the back of their mind when they're seeing patients over the next couple of years. Not to overemphasize it, but to think about things, because, you know, sometimes diagnostic diagnoses are sometimes a little bit evasive, and so it's important to think about.
And I do think for our athletes, like, you know, I know there's a couple of people that, similar to Mary Frances, found cardiac issues after not really having, you know, being really sick when they got COVID, but it was after the fact. And if not for that evaluation, they may not have found it. So,
Right.
But if you're going to the doctor.
Right. That's important.
All right. Thank you.
Sure. Any other comments?
I just have a point of inquiry as the new guy on the board here. We received all these letters tonight from the public, you know, to us specifically, you know, regarding the school mask, you know, mandates. Is there a recommendation to the school board? Do we need to have maybe a formal, you know, vote to have that opinion to them, since it was being asked of us?
No.
Or where does that go?
So I specifically asked the superintendent and the chairman of the Board of Ed if they had any particular agenda items, any motions they would like us to consider, and we weren't asked to consider anything. Traditionally, the Board of Health does not make policy for the schools, you know, and so that's the sort of divide there. We make policies for the school nurses who are Town of Fairfield employees and work for the health department. They follow the policies approved by the board, but the elected officials on the Board of Ed make the decisions regarding providing a safe environment for kids in schools.
Great, thank you for the clarification.
All right. So if there are no other comments, anybody else before we conclude the meeting? So, is there a motion to adjourn?
Hello? Hello?
Yes.
Hi there. My name's Ginger Parsons. I have one quick question. Thank you so much for your thoughtful time and consideration. I apologize if I missed this earlier. Was there any conversation about changing the distancing recommendations in the school as far as how far apart the children are sitting or eating lunch next to each other, not speaking when the masks aren't on, those types of things?
I don't think that...
Sans Cleary, we didn't have any specific discussion on that. In the conversations I've had with the superintendent, you know, both recently and before, is achieving as much space as possible, you know, is desirable.
Okay, so there is no, 3 feet and more has to be followed, or those types of things that we've been discussing before that have been in place?
3-foot distancing is still in place.
Yeah, I mean, that's the goal, is to have 3-foot distance, and if you can achieve more in certain situations, to do that. Yeah,
Okay, thank you for clarifying.
of course.
Sure. Anybody else on the phone? Any other comments or questions? We appreciate everybody's involvement, and so is there a motion to adjourn? That's it. All in favor?
Thank you, everyone.
All right.
Thank
Hi.
you.
You all.
Thank you.